Welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, September the 1st. We are joined today by our Acting Medical Officer of Health, Dr. Shankar Nesathure, as well as our CEO, Nicole Dupuis. This morning, we are going to move right into a round of media questions, starting with 2 questions from each outlet. We will open with questions from the Windsor Star.
Good morning. Dr. Nesathure, today Health Canada is set to make an announcement regarding the new bivalent vaccines for Omicron variant. But looking at the Windsor-Essex County Health Unit's vaccine dashboard, we're currently at 12.1% of our population having received the 4th dose, and that figure has barely moved all summer. What concerns do you have that the public, the local public and the general public are simply done taking vaccines on COVID?
Well, we remain concerned that there's a low number of people who are up to date on their vaccines. I would recommend as a doctor that if you're eligible for a vaccine, come up to date. When somebody gets vaccinated, they're helping themselves. That is that they're minimizing the burden or the effect of COVID-19 or any disease on themselves, reducing the chances of acquiring it in general, and also reducing the level of severity in many cases. You're also preventing the transmission of disease to other people, and we want to try to break the chain of transmission. So when you get vaccinated, you help yourself in general, and you help other people as a general construct. Additionally, COVID-19 has a significant burden to the healthcare system, and it puts additional strains on a healthcare system that has already had a lot of demands. We want to try to minimize the number of people who present to the hospital with COVID-19 symptoms or any respiratory disease symptoms. We're also concerned that the fall is the beginning, is when the flu season starts. More people are indoors, and we have both the challenge of the flu and of COVID and of more people indoors and of a health system that which has strained resources. So we are very concerned that the health service vaccine uptake is not where we'd like it to be. I recognize that we're in the third year of the pandemic, and we're all fatigued by hearing about the pandemic and all the public health measures and the general guidance. But like all citizens, we have to do our best to contribute to the health of our individuals and our families and the overall community.
Doctor, to what extent do you feel it's a public messaging problem? Because all the things that you said are things that you have said consistently, and yet the public is not getting the message.
Well, I'm pleased that you acknowledge that I've said it consistently, so thank you. I think that part of the public health service is to communicate messages and hope that there is a level of acceptance and uptake of those messages. It remains a challenge. There's no doubt about it. It remains a challenge that we have not been able to get our vaccination rates to a higher level. I'm hopeful that with consistent messaging at the local level and at the provincial level, that we can move forward with trying to effectuate vaccination rates. I am worried about a large uptick in cases in the fall and additional burden to the healthcare system in the fall. And it is, I think, a concern of, well, it's my concern for sure, and I think it's a concern of the public health service overall.
Thank you.
We will move to questions from AM 800.
Thank you. Speaking of messaging, with back to school obviously happening next week, what's the health unit message to parents and students in terms of trying to keep themselves safe ahead of a period that you just mentioned you're anticipating there being more respiratory disease in the community?
Well, first and foremost, school is a priority for young people, and from a public health point of view, it's one of the opportunities for children to develop. And I'm delighted that school is starting again, and I recognize, and I think we all recognize, that it's a challenging time for families. I think that I would encourage parents to avail themselves for their children to get up to date on their vaccines. and that includes the COVID vaccine. We have the vaccine verification process initiated and going forward in September. Many people have availed themselves to bring their children up to date, either their records up to date or get their actual injections up to date. We're providing lots of opportunities to get vaccines. Physicians' offices and clinics also can provide vaccines to bring young people up to date. But more importantly, I think a goal, or as equally important, an important goal, is to keep schools open and to keep as many young people in schools so they can get a good educational experience moving forward.
And then in terms of the vaccination numbers, not just COVID, obviously, is there an update on what number we're looking at in terms of students still kind of up in the air for being able to go back to school?
Yeah, I think Nicole has that number. Perhaps she can share her thoughts on that.
Yeah, I think last week when I was asked, we were at around just over 5,000, and we're now just under 4,000. So we are keeping a pretty steady pace, a little over 1,000 students a week that we're, taking off that list. So again, really hopeful that we will get to our goal of 0 by the time we get to our suspension date in the middle of September.
Thank you.
Thank you. We'll move to questions from CTV.
Good morning. So just yesterday, it was announced that Ontario is scrapping its mandatory 5-day isolation rule for individuals who test positive, essentially meaning that once symptoms are no longer apparent, they can return to work or school after 24 hours. And in a media briefing, when he was asked, does this mean then that somebody could technically still be positive and go to work? Dr. Karen Moore's quote was, "That is correct." So I guess I wanted to get a reaction from you. Well, what are your thoughts? You just mentioned you're concerned about a rise in cases in the fall, and yet we now have, I guess, an apparent situation where you're going to definitely have COVID positive people more often around us. Well, what are your thoughts on the development from yesterday?
Well, I think a couple of things. As a general construct in medicine, if you're sick, stay at home. That's always been the messaging, but now I think that messaging has been more accepted by the community overall. I think if you test positive with COVID, a person has to make some important decisions and has some important responsibilities. I would say stay at home. We have to follow the provincial guidance. It's for the province to formulate public health policy of this nature. But on an individual level, I would advise people that if you've tested positive for COVID, you're likely to be infectious for a 10-day period. And during that period, you should do everything you can to prevent other people from getting sick. And that includes wearing a mask consistently and staying away from people that are particularly vulnerable, like the elderly or people with significant medical problems. Additionally, institutions and workplaces can put forth more cautious policies than the general guidance given by the province. So, but I would emphasize that people who have tested positive for COVID are infectious and can transmit the disease to other people. They're at a higher risk of transmitting the disease to other people early on than late. And so it's something that is of concern to me. And we do want to try to minimize the transmission of COVID-19. I know I've said this many times, and I ask for your forgiveness for me being repetitive, but it's just not the person who gets COVID that we're worried about. It's also the fact that we're worried about the chain of transmission, where COVID goes from one person to another person and ultimately gets to a person who's more vulnerable. Also, COVID is not a benign disease. Most people do recover, but some people have long-term consequences of that. Colloquially, it's labeled or call it long COVID syndrome. And for those people who have long COVID syndrome or long COVID symptoms, it can be devastating. So there is a reason to try to minimize your chance of getting COVID. as well as trying to prevent the transmission of disease to your coworkers or your friends or other people that you might be close to.
And just doubling back on Dawson's question from earlier regarding the messaging, of course, it's been established that you've been quite consistent with the messaging that you've provided with the community. But are you concerned that this directive from the province may kind of add more confusion and kind of undo some of that messaging that you've tried to be consistent with, considering now they're openly saying, yes, it looks like, with measures like masking and stuff, but nonetheless, yes, you can be positive and still go to work if you're symptom free for 24 hours. Are you concerned that the province's directive kind of undoes some of that messaging?
Well, we try our very best to work with our colleagues at all levels of government. There's a local public health service, there's a provincial public health service, and if there's a federal public health service, and each of us has responsibilities. As it relates to policies of this nature, it is we take the lead or take guidance and direction from provincial officials. I think that as an overall construct, as an overall goal, we want to have clear and consistent messaging. And at the local public health service, we work to try to, provide that messaging as best as we can. It is clear that COVID is the management of COVID has changed, and it's a challenge in messaging when we change our messaging as well. So, in a nutshell, we want to try our very best at the local level to provide messaging to members of the Windsor-Essex.
Great, thank you. We will move to questions from Blackburn.
You mentioned, Dr. Nasathuri, that workplaces could be more cautious than the provincial guidelines. Do you encourage workplaces to adopt more cautious guidelines in their own, with their own organizations?
Yes, I think that employers have a responsibility to keep their workers safe. Some employers serve critical and vital functions like hospitals and other institutions, and so they have to make an individual decision for their organization. But I do think that if they elect more conservative approaches, I think that's perfectly appropriate. And in some cases, I think that's consistent with their mandate to keep the institution functioning.
And of course, we know that long COVID is certainly an issue, but do we have any statistics on how many people in this region have been diagnosed with long COVID?
If you send an email to our epidemiologist, I'll ask him to see if we have any data on that at a local level. If we don't have it on a local level, we can maybe share it more generally. One of the challenges with our enumerating people of long COVID is the clinical definition of long COVID. But we'll try to provide you additional information if you could send an email after this press conference.
Thank you.
Any questions from CBC?
Yes, with regards to changing isolation or the dropping of the isolation requirement, do you still have the power to impose COVID restrictions over and above what the province has? And is this a case where you might consider doing that?
Well, the public health statute gives broad powers to local medical officers of health, but we try to use those. We try to use those powers judiciously, and at this point, the local health services not planning any additional direction beyond the provincial direction.
Were other medical officers of health, like yourself and others around the province, were they consulted on this decision?
Well, I can only speak for myself. We do have dialogue with provincial officials on a regular basis about a wide variety of public health measures. With regards to this specific announcement, I didn't have any direct input into it prior to its announcement.
Thank you.
We will move to a round of follow-up questions with one question per outlet. We will start with the Windsor Star.
Nothing further, thank you.
Thank you. AM 800.
I'm good as well. Thank you.
CTV.
I am good right now. Thank you.
Okay, thank you. Blackburn
I'm good too.
and CBC.
Yes, just one more question on the isolation issue. You mentioned that perfect storm of variables coming in the fall. How do you think that the shift in guidance surrounding isolation is going to play out or perhaps contribute to that scenario?
Well, it's always difficult to predict the future. Withdrawing the isolation requirements or modifying the isolation requirements is a form of public health relaxation or public health measure relaxation. If there is an additional level of disease, this would only further contribute to disease transmission and disease burden. But it's complicated because there are a lot of variables to impute any projection moving forward. I do think that the key message that I would leave with is that if you do have COVID, notwithstanding the fact that you don't have to self-isolate for 5 days, it's important that people who have tested positive for COVID-related symptoms take individual responsibility and do the things to mitigate and minimize the transmission to other people. And that's something that we can all do right now and moving forward into the fall. I also think that public health measures, if we're going to, and if you'd indulge me in this, I think it's important that we normalize or move to a more normalized level of COVID-19, meaning this, COVID-19 is not going away. The pandemic is not over. We're going to have to learn to live with COVID-19 and keep our institutions, our vital institutions functioning. That includes hospitals, schools, businesses. That's something we as a society have to do to move forward. But to move forward, we have to do it in a way that has a bold group of measures. And among them is to accept that public health measures may change based on the burden of disease. And at times of increased disease activity, we may have to go back to things like masking and even have a further emphasis on social distancing. Moving forward indefinitely, if you're sick, stay at home. I think those are things to think of. Secondly, we have to build additional capacity in the healthcare system. We already see it now where workers are being disqualified from working, and a significant number of hospital beds and hospital resources are being occupied by people who have COVID. And we need to be able to fit that into our clinical service models so that we can treat people with COVID and treat people with other illnesses. We're going to need to have a regular period of vaccination, so that I think that and we're going to have an effective system of getting antiviral drugs to people who are eligible for them. I think those are the approaches that we can do to learn to live with COVID moving forward in September. And we should also accept that we have things that we can all do to make September, October, November more normalized, and that is to get vaccinated. I think that if you're eligible for a vaccine, get a vaccine. I think it'll make a difference moving forward on a community level.
That concludes our media briefing for this week. Thank you all for joining us. Our next scheduled briefing will take place on Thursday, September the 8th. Have a great afternoon and a wonderful long weekend.
All the best.
You too. Thank you.
Thank you. Have a good day.